Hi everyone! Thanks for checking out my vlog, A Dose of Reason. I'm Dr. Shira, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. For the past 8.5 months, I've looked forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions to discuss in the next vlog. Sigh. I don't like it when cases are going up, but cases have been going up. I bet you can feel it. Seems like everyone I know has COVID these days again. Now, I know hospitalization numbers look like they're rising too, but I'm not seeing that here at my hospital. And the good news is that here in Mass, when we measure whether people in the hospital have a primary versus an incidental diagnosis of COVID, an increasing percentage are incidental, more than 60% these days. The CDC doesn't take that into account though, so unfortunately, much of the Northeast has crossed into the orange or high risk category on the CDC risk level map, meaning masks are recommended. Treatment remains widely available, but a lot of people don't know that. So the White House recently announced it would be putting more effort into making treatments accessible and into communicating with prescribers and the public about the treatment options. And Massachusetts announced last week a terrific new program, a free public telehealth program so you can get treated for COVID even if you don't have a primary care doctor of your own. That's amazing. The other big news is the Cdc Seroprevalence Study. That's a study using antibody tests on blood, which showed that as of February 2022, 75% of U.S. children had been infected with COVID, and a majority of adults under 49. That doesn't mean that those people can't get infected again, but we are slowly building up immunity within the population from repeated infection and vaccination. Our first question comes from Carolina from Waltham. I planned for this summer under the assumption that things would be pretty close to normal, camp for the kids, several vacations, etc., and now I'm starting to get a little nervous. What is the likelihood we will actually get 2 or 3 months of normalcy in New England this summer? And is this up and down COVID roller coaster ever likely to end? Well, I think this up and down roller coaster is, unfortunately, our new normal. And part of what makes it so roller coaster-like is worrying about what new restrictions are going to be imposed and what's going to be canceled. And the other part of what makes it so stressful is not knowing what to do, how much to restrict your own life, and how much to sacrifice in order to avoid the virus. There are huge parts of the country where people don't worry about those things. I think that government officials are increasingly unlikely to impose new mandates and restrictions. You might find that reassuring or you might find that worrisome. But I think, and I have to admit, I get pushback when I say this, but we have tools at our disposal that make broad mandates largely unnecessary. Tools like boosters and high-quality one-way masking and home testing and lots of treatments. I also truly believe that everyone will get COVID. It's just that contagious and that widespread, and it isn't going away. So I live my life pretty close to normally without much sacrifice, unless I have an important event I can't miss, and then I take extra precautions for a few days before it. For me, that's what the new normal looks like. You might be different, and I respect that. Brittany from Mobile, Alabama asked, why can't people who are under 50 and not immunocompromised get a 4th shot in the US? Is it a safety issue, funding? I see that people in other countries are allowed to get 4th shots. I had 3 Pfizer shots, and I'm worried that that combination is not as protective as it would be if I'd had at least 1 Moderna. Brittany, I know there are so many headlines and the information is so confusing. Try to ignore the media on this one because you will often see things that scare you. There's plenty of vaccine in the country right now, and the vaccine is safe. The reason the 4th dose is not recommended for everyone is because it simply doesn't help everyone. In an Israeli study of adult healthcare workers of all ages who got a 4th dose. Those who received Pfizer as their 4th dose had a 30% decrease in infections compared to people who had had 3 doses. And those who received Moderna as their 4th dose had an 11% reduction. But that was just in the first couple of weeks, and we know that protection against infection wanes fast. No one in any of the 3 groups that had had 3 shots had anything more than mild disease. I had 3 Pfizer shots, and when I became eligible for that 3rd shot, mixing and matching was not yet permitted, and I didn't want to wait, so I got Pfizer again. When I get my 4th shot in the future, I do plan to get Moderna because it looks like it might be a little better to mix it up. I'm eligible to get my 4th shot now, but the data show that, if anything, the 4th shot takes a tiny risk and makes it a tinier risk for someone like me. My strategy is that since the 4th shot will very briefly protect me a little bit from getting infected, I will time it with some international travel that I have scheduled for this summer. Our last question comes from Marina from Bedford. I'm getting really nervous about the cases of hepatitis I've been hearing about in kids around the world. Some of them have died. What do you think is causing it, and is there anything I should be doing to protect my kids? Well, the CDC, WHO, and other health authorities around the world are hard at work investigating this phenomenon where young children are presenting with hepatitis, which is inflammation of the liver due to an unknown cause. You may hear numbers like over 100 cases in the US and over 200 cases worldwide, but that's because they are casting a wide net that goes back months. It's not entirely clear that there is even anything unusual going on, since some cases of unexplained hepatitis are normally seen every year. It does not appear to be related to COVID-19. It may or may not even be an infection, but some of the kids have tested positive for a virus called adenovirus, although that virus wasn't found in their livers. It's definitely not due to vaccines. You don't need to do anything special to protect your kids from this very rare condition, except follow good hygiene practices like hand washing. Here are some of the more common signs and symptoms of hepatitis. As always, though, if your child is sick, call your doctor. That's all the time we have for this week. You can send me your questions about the recent increase in COVID cases, Omicron subvariants, COVID treatments, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again in 2 weeks.